Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. Today we are reporting 19 new cases of COVID-19 in Windsor and Essex County. 5 are close contacts of confirmed cases, 2 are related to outbreaks, 4 are community acquired, and 7 are still being investigated. We have had 12,393 cases since last March. 11,734 cases are now resolved, and 314 people are active cases at this time. 53 confirmed cases are currently in the hospital, and 12 people are in ICU. Our community has lost 343 people to COVID. We are reporting 2 additional deaths today, a man in his 80s from a long-term care home, and a woman in her 90s from the community. 223 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 24 active outbreaks in Windsor and Essex County. 9 are in workplaces, 10 in long-term care and retirement homes, 4 outbreaks in our hospitals, and 1 community outbreak. Despite the beginning of the vaccine rollout, public health measures must continue. Stay home if you're sick, limit your close contacts to household members, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. If you have any symptoms of COVID, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us again. Yesterday, the province announced their plans to open the regions based on the local epidemiology and overall trend of decreasing case counts across the region, across many regions of Ontario. Our region went into gray lockdown for almost 2 months, 2 months ago, and we're still in this phase right now. Our weekly case rates continues to improve, and our most recent case rate, weekly case rate is somewhere between 50 and 60 cases per 100,000 population, and with a percent positivity of close to 4.5 as reported last week. While it is understandable for the province to open things up for the mental, social, and economic well-being, it is also important for us as the residents to understand what it means for all of us. All of us have sacrificed a lot throughout this pandemic, and some people are sacrificing more than the others. We've been in lockdown for 2 months with very limited activities, very limited economic activities, very limited social activities, very limited mental well-being as living in the pandemic and in lockdown has made us not to do things that we used to do. It is important that we understand that what we have done, what we have accomplished in the last 2 months, where we were and how far we have come along. At one point in the pandemic, our weekly case rate was close to 350 or 360 cases per 100,000 population per week. Now we have dropped down to close to 50 and 60 cases, which is significant improvement, all through the hard work of all the residents and everyone who has sacrificed to bring us to the position where we are in. We also have to recognize that this is still a global pandemic, and our case rates are still high, much higher than where we were before in September or October timeline. So there is this potential, and we have seen that things can change very quickly. We have seen how quickly things got worsened in November and December, with our weekly case rates topping more than 1,000 cases a week. So it is important that we understand that what we are seeing right now, it can change very quickly. And the only thing that we can do is to continue to follow these public health measures. We also have to recognize that we still have a COVID variant that is circulating in other parts of the province. And it won't be too long before we will have our local case of COVID variant in our region. And as we know that the COVID variant can spread even much quickly than the others. So what we have seen in November and December timeline, it can be even worse than what would happen if we see a COVID variant in our region. So it is absolutely important that while we talk about reopening, while we think about how the region will start to get back to some kind of normalcy, but those risks will continue to exist in our community. And the best way to keep safe, keep everyone safe, keep yourself safe, keep your businesses safe, is to follow these public health measures. There are a number of guidance documents, there are a number of tools that are available on our website on different information that we have been putting out for a number of months now to ensure that everything can open safely and everyone can follow these public health measures. We also need to understand that we have to protect our most vulnerable, our most senior in the community, long-term care home, retirement home, people who are visiting there, people who are going to see their loved ones. They have to follow many of the precautions, many of the recommendations that have been put forward. You have to recognize that it takes one person to bring the infection inside any long-term care home and retirement home, and it can spread like wildfire. And especially when we are talking again about the variant of concern, if that variant of concern is introduced into these long-term care homes, it can be a death sentence for many people. So we have to recognize and we have to understand that all of us have a role to play in that. Talking about the retails and businesses, we have seen that there are some provisions that are given to the retail sectors to open up even if a region is in lockdown. It does mean that there is a serious understanding of the challenges that small businesses and retail businesses are facing in the community and in the province, but it also highlights the importance of how all of these measures should help to control the spread of the disease. So while they are opening, it is also very important for them to understand what it means to keep their businesses safe and to keep everyone safe. Lastly, the schools. Today is day 2 for children going back to school. It is really important that the parents, that the teachers, that the staff at the school, they are all following public health measures. They're all doing the screening to make sure that they are not bringing any case into the school system and to continue to keep school safe. Together, we can all keep our community safe, keep our high-risk population safe, and keep the case rates down to a level where we can continue to enjoy whatever we can in this global pandemic. The winter is still upon us. There's still a few months before we can go outside and enjoy the outdoors. So until then, we still have to make sure that whatever we are doing it to keep everyone safe. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning. This is a question just about the community outbreak. I see it's Kensington Court retirement residents. Yesterday that was listed as the long-term care and retirement homes. Why put that as a community outbreak?
I have to look at that, Taylor, but just to your question, so Kensington Court is not a registered retirement home or a long-term care home, and it is a community building, and which is dedicated specifically for seniors. So anytime when it's not a registered long-term care home or retirement home, it will not be considered as part of the long-term care home or retirement home, and it will be considered as a community outbreak.
Okay, thank you. And then I'm looking to get your reaction to yesterday's announcement. I know today you're talking about the importance of following public health measures even with reopening. Do you think the province's announcement yesterday was reasonable?
Well, I think it's a tough balance, and there is no right answer. And when we are trying to balance the risks to the health and also trying to balance the risk to social, mental, and economic health or economic well-being. And everyone may have different level of risk tolerance, risk perception. we all have to work together to make sure that we are not ignoring any one particular area. So seeing that, it's understandable that the government is trying to balance that risk. And I think as locally, as individually, we also have to understand that it's not only the government that will solve all our problems, it's us too. We have to play our part to make sure that we are doing our part to keep the community safe, to keep everyone safe. So I think it's a fine balance at this time, and I truly hope that people understand and probably know by now that how quickly things can change and the importance of following these public health measures to keep everyone safe.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, I know you mentioned this last week, but with our current numbers, and just say the Premier of the province made an announcement that we can get out of lockdown, would we still shift to the red zone based on our current numbers?
This is my understanding. So obviously, my expectation is we'll probably have we'll go back to the similar process that we used to have before, and we will review the data before the province will make a decision to move certain regions in a different category. So we'll have to go back and we'll have to see what the data looks like at that time. So for example, if any decision is to be made for Monday or Tuesday, they have to make a decision by looking at the data by Thursday or Friday. And when they look at the data, they will make a recommendation based on that, plus any additional context that we can provide locally.
I guess your personal feelings, would you like to see us start in, I guess, the red zone instead of going to yellow or orange? Because like you said, if we open too quickly, who knows what could happen?
Well, I guess I can have my own preference, but clearly the province has indicated that they are going back to the framework that was used in the fall, and based on that framework, the case rates are already suggesting that we are still in the high red zone, and we're nowhere close to yellow or green zone. So it will take us some time to get to the point, and I'm confident that we can get there when we have the support of our residents. And the more and more people understand the importance and the benefits of following these public health measures, I'm confident that eventually we'll get to yellow or green, or to a place where we will have as much as normalcy as possible we can get in this pandemic. But right now, based on our case rates, we are in the red zone, unless things change in the next few days before the provincial announcement.
Thank you.
Any questions from CTV?
Yes, good morning. It seems like there's a lot of confusion from residents and business owners about the province's announcement. I guess non-essential retail can reopen no matter what. Non-essential non-retail are still waiting. Do you think the messaging needs to be more clear, and what is your message to residents and business owners?
Well, I think we can always have clear messaging as much as possible to avoid any confusion, especially for the people who are directly impacted by it. There are a number of documents that are typically created when these type of things come into play, to provide as much as detail possible for the businesses and everyone who is impacted by it. From our perspective, as we have always, and I've been saying this, that there are toolkits available for businesses on our website. There are a number of resources that are available to make sure that all of these people understand what they can do to keep their businesses safe. In addition, they also need to have a safety plan in case if they have a case of COVID, or how they will protect their employees, how they will protect all of their patrons visiting these establishments. So I think it's important that the businesses and the retail industry look at those resources and to get a very clear understanding of what the expectation is and how they can keep everything safe. And I'm confident that they can do it. There are many people who are really serious in ensuring the safety and well-being of their patrons to allow others to come and visit their establishment. It is in their interest. If the businesses seem that they are not doing anything, there will be less people going into the establishment. So I think it is in the interest of the businesses as well to make sure that they have all these good policies in place to keep everyone safe. And there are resources out there that would help them to make sure that they are complying with all these regulations, requirements, and providing a very safe environment for the patrons to come and visit their establishment.
And I guess the other question people are asking is, when is the province going to make the announcement as far as what color change we're going to? And I know that you're not necessarily in on that decision, but as far as when do you think we should learn in the fall, they announce on Fridays, given your epi summary on Fridays, do you think that would be a good time for them to decide what level we can move to?
Well, I think historically they typically made the announcement on Fridays, so I'm guessing that would continue. And by Thursday, by Friday, early Friday, we typically share the data with them, and they will have most up-to-date data, information, and if there's a need for any consultation or discussion with us, that would happen. And finally, an announcement will be made by the province on Friday.
Okay, great, thank you.
Any questions from CBC?
Dr. Ahmed, just to clarify, the new rules around retail stores opening in lockdown zones, is that immediate or does that begin when the stay-home order is lifted?
So I think the everything will continue to be in the same stage where we are right now, except for the 3 regions that the Premier announced yesterday. So those 3 regions will move to the green zone on Wednesday, but for the rest of the province, we will continue to be in the same stage. And then when we move on to Tuesday or Wednesday, or Monday or Tuesday, I forgot the exact date, so my apologies. Whenever we will move, the stay-at-home order will be lifted, and then depending on the color coding scheme where we are, all of those retail requirements and every other requirements will come into play on that day. Until then, we are still in lockdown, we are still in stay-at-home order.
Okay, thank you. A little while back, there was news of rapid tests for visitors at long-term care homes. I'm wondering if that's a possibility in our region for the future, or if you know of any plans underway?
So it is a requirement for the visitors to get that rapid testing done. So it's not a possibility, it's a requirement now from the Ministry of Long-Term Care. And so that is, I think it's already implemented to my understanding. And we will see more and more of those details and more areas that may adopt it to enforce it strictly.
Thank you.
Any questions from Blackburn?
No, thank you. The open asked answered. Thank you.
Any further questions from the Windsor Star?
No, thank you.
AMA 100?
Sorry, just one, Dr. Ahmed, going back to the color system, with the stay-at-home order in place until next Tuesday, do you anticipate the province making the announcement this coming Friday, or do you think they would wait? Because Monday's a holiday in the province. What is your gut telling you? They would announce it this Friday?
I think that they would announce it on Friday, but again, the province have their own mind. I can only say based on my previous experiences and what my understanding tells me, because they have to make certain changes in the in the regulation to allow for all of these changes, and it takes few days to actually implement. So my feeling is still it will be Friday that we should get the announcement.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
No, thank you.
Blackburn?
No, thank you.
Thank you, everyone. Have a great day.
Thank you.